Hi, this is Eric Price, Tomah Health Marketing Director. On this edition of HealthCheck 360, we're going to take a look at rural healthcare and the impact on hospitals like Tomah Health. So thanks for joining us. Incorporated in 1979 as the Rural Wisconsin Hospital Cooperative, the co-op has received national recognition as one of the country's earliest and most successful models for networking among rural hospitals. Today, the work continues, and we are pleased today to welcome the Executive Director of the Rural Wisconsin Health Cooperative, Tim Size. Thanks for joining us, Tim.
Thanks for having me.
So tell us a little bit about your position, how long you've been at the co-op.
Well, it's hard to imagine, but I've been there 45 years and worked a little with the 6 founding members before that in incorporating the co-op. Basically, we chose the cooperative model because of its emphasis on independence, which was important to those founders and is still very important to many of our members.
So the co-op, for those who do not know, is owned and operated by 40, I think that's still the correct number,
yes,
rural acute, general medical, surgical hospitals, including us here at Tomah Health. So what's the role of the co-op in relationship to those systems and hospitals?
Well, our overall vision is to have the rural communities in Wisconsin be amongst the healthiest in the country. Actually, I should say the healthiest. I argued for it to be amongst, and my board said no, we want it to be the healthiest. We want to be strong, we want to be innovative, and basically, I work there, we have a great team that works there, but the co-op are the 40 hospitals and their commitment to working with each other, sharing innovations, providing support. We meet, all the members meet, those that can show up meet there monthly, either in person or virtually. And so the co-op is really about these 40 hospitals working together to accomplish better health care.
So let's find out how that works, because also joined today we are by the Chief Executive Officer of Tomah Health, Derek Daly. Welcome, Derek.
Thanks, appreciate being here.
So you've been CEO since August of 2022, time flies. Tell us a little bit about those first 2 years here at Tomah Health.
Yeah, coming up on 2.5 years next month. It's really been a whirlwind. We've had a very busy couple of years at Tomah Health, whether from the patient volume perspective, the initiative perspective, really a great couple of years, the last couple of years here at Tomah Health, and excited for what 2025 has in store coming up here in a month or so.
So how does the co-op then, kind of dovetailing then into the co-op, how does Tomah Health work with the cooperative to strengthen that rural health component?
Yeah, we've been a long-standing member of the co-op and working with Tim and his wonderful team, and really had a good opportunity to engage with our peers, collaborate with our peers, many times share best practice, talk through opportunities that we jointly might have as a co-op, as individual facilities, and in certain situations, opportunities to contract together to do some things that we might not otherwise be able to do on our own.
So let's take a step back, talk about rural health. People might go and assume what it is, but from your perspective, Derek, what's your take on rural health and how does that fit into the Tomah community?
Yeah, so we feel that healthcare is best provided local, where patients are. And for the services that we can provide in our local communities, we think it's very vitally important that people get their services here, so as not having to drive to a larger community. And that is something that almost everyone in rural health is passionate about, and something that is part of the reason that I got into the industry that we are in today. And not just for the health of the communities. Hospitals in rural health are vital for the overall well-being of the communities they serve, physical health related and not. And whether it's through the creation of economic development, the creation of new businesses and jobs, the support of schools, hospitals and healthcare systems are vitally important to the local communities and areas that they serve.
And we're going to talk a little bit more, dive more into that a little bit later in the program. Tim, then, rural health from your perspective, 40 plus years, and I know you've got lots of descriptions, but from your perspective, what is rural health?
I couldn't do a better job than what Derek just said, and even if he was not on my board, I would say that. But yeah, it's about regular healthcare local. It's about emergency healthcare in particular. It's about local community economic development. Rural Wisconsin is challenged in many ways, like much of rural America. And the rural hospital is just a central component of what can make a community more healthy, not only physical health or mental health, but also economic health. So the co-op has gotten much more involved with issues around childcare, and I believe that's an issue you all are working on here, around housing. Workforce is a big issue for the co-op, and if we don't have housing for people, it's hard to recruit. The community impact is often not really thought of very deeply, but because this hospital here is here and has been here for quite a while, that accounts for, from the data we have, 800 jobs in this community, and for both revenue here at the hospital, but the revenue that the hospital helps generate out in the community, $126 million a year. That's, for a rural community, big numbers. So rural health is all that. It's also about dealing with disparities. One of the, hasn't gotten probably enough attention, but during COVID, the death rate in rural Wisconsin was about a third higher than urban. The good news, it was closer, it wasn't as much a difference as it was in America, but that's still a big difference. And that's one example of the work that's unfinished. Because people in rural Wisconsin, like rural America, they tend to be older, they're more vulnerable to disease, they tend to be sicker, they tend to have lower income. All that means we have our work cut out for us. And it's not an accident that at my age I'm still working, because it doesn't feel like work. It's like a mission, it's a joy.
Hey, you probably touched a little bit on when you described rural health, but what would you say about the state of rural health in Wisconsin?
I knew you were going to ask that, so I wrote it down. I would call it strong, but not without challenge. We have funding shortages. We're underpaid by Medicare, by Medicaid, by commercial insurers. We have a growing workforce shortage because people are retiring at record numbers due to baby boomers. And unfortunately, as baby boomers age, they need a lot more health care. So there's a tripling, a quadrupling of health care. So the demand for health care is going up. At the same time, the supply is at best of workers, doctors, nurses, therapists, is staying flat. So we're forecasting close to 20% shortages by 2035. And that's more shortage than at the worst of the COVID pandemic, when all hospitals were deferring admissions. They just didn't have the room. Well, they had the room, they didn't have the staff. In rural Wisconsin, like much of rural America, many, if not most, of our counties are declining population. So you can run a great hospital like Tomah Health, but if your community's shrinking, that's not good for you. So we got challenges, but we have a strong history, so I tend to be very optimistic, and I will have more to say on that in a second.
Derek, let's talk a little bit about the uniqueness of Tomah Health. Folks may not understand, but we're an independent facility. So tell us a little bit about what being independent means, not only for the facility and our staff, but also for residents in Tomah.
Yeah, some of the core tenets of independence for us means we are governed by a local governing body. Our operations are ran by a local administrative team. We are able to make local decisions that better suit the needs of our community and the surrounding area. We are also able to be better suited to locally invest in Tomah, in the surrounding area, in the communities we serve, in a more targeted approach than we otherwise would be able to as a larger system that's got different competing interests in different portions of their service area. So for us, local independence, local control, local ability to make good decisions that support our population.
And all those decisions translate then into kind of the bottom line from a social but also economic impact. How would you describe the relationship on the local economy and the community as a whole then?
Yeah, just a great question. As we've talked about a little bit earlier, hospitals are a cornerstone in any rural community, and it's hard pressed to find a community where the hospital or the health system isn't in the top 2 to 3 largest employers in the community. Tomah Health certainly not any different, with 500 plus employees, caregivers, and contracted providers on our campus. We very much have that opportunity to have that impact on our community and on our economy. I think mentioned earlier, just the types of direct or indirect economic activity that can be driven by having a hospital in town or not is immense. 125 plus million in economic impact for Tomah Health on an annual basis. Another $6 million in other funding for things like uncompensated care, service lines that we keep open for the betterment of the community that lose money and do so intentionally to further our mission. So hospitals at the local level, very impactful for our communities and the economy within it.
And Tim, I would guess for the 39 others in the co-op, kind of the same story, but maybe there's been a few little changes over the past year or so.
I would reinforce what Derek just said, is that I would say the most important strategy for a rural hospital is to be as close and connected with their community as possible. And I would say to various degrees that's understood and acted upon with all 40 hospitals in the co-op. How much things have changed, I think the biggest change I have seen in the last few years is a much more aggressive health insurance industry, which has gotten to be a problem. I think I haven't talked with a doctor in the last couple of years who doesn't very quickly say prior authorization is driving them nuts. And it's seen by an increasing number of people as a way of slowing down care or eliminating care. I don't know what the solution is, but I know that we need to begin to be more honest in addressing it, because a lot of unhappy people, and it consumes a lot of physician and nursing time addressing this increase. But the whole tone, we have to rediscover how to partner with insurers, and insurers partner with us, and I would say there's not a lot of partnerships going on right now.
And I would think, just based on the national news that you're hearing specifically now, people can understand, or they're hearing bits and pieces of that story about how insurance plays into a hospital setting. So I would certainly agree with that. We don't want to talk a little bit about critical access hospitals, and not to throw a lot of other terms in there, but Tomah Health is a critical access hospital. And by that, there's it was actually started back in, the designation was in 1997, when the Balanced Budget Act, in response to a string of hospital closures at the time in the 1980s and early 90s, designated to reduce the financial vulnerability of rural hospitals and hopefully improve the access to health care and keep those services in place, especially in rural communities. Tim, from your perspective, I know the critical access hospital designation plays still into play for rural hospitals as well.
It's extremely important. A lot of your listeners may be aware, because it's been in national news so much in the last year, there's still many rural hospitals across the country at risk of closure. I think the number I see most often is around 700. That's about 30% of rural hospitals. Now, the good news is that number is much lower in Wisconsin. So I think there's maybe 7 or 8 rural hospitals that are thought to be at risk, but those numbers can change. Critical access hospital, which is a Medicare designation, those hospitals get some supplemental funding, has been absolutely instrumental to the preservation of the rural health as we know it, but it's work that's not yet complete. critical access hospitals are still losing money on average from Medicare. They lose even more money on Medicaid. And particularly if they provide maternity services, which you do, it's ridiculous how little the state Medicaid program pays. So we have our work cut out for us. And I'm an advocate. It's in my DNA. It's in my blood. And I, on a good day, can maybe change a mind or two. But really what makes a difference is when people in the community make it clear how much they support local rural health. And that's why I think rural health has a bright future, because people support a well-run hospital like Tomah Health.
So Derek, then kind of moving on with that critical access part of it, nationally nearly 46 million Americans live in rural areas, and they rely on hospitals not only for their care, but how they talked a little bit more before about economic and social fabric. Let's talk a little bit about challenges. Challenged economies, we've heard about rural facilities closing, reopening, changing their mission a little bit. How would you describe the state here at Tomah Health?
Yeah, so great question. And at Tomah Health, we have the opportunity to, or good fortune, I should say, of really having a good last few years. We, like many of the other facilities in the state of Wisconsin, are currently faring better despite the challenges than much of the rural healthcare industry across our country. And that doesn't mean we're not without our challenges of recruitment and retention, increasing labor and non-labor costs, and decreasing insurance company reimbursement. We certainly are. We just have had the opportunity to, through things such as the co-op or a great hospital association here, be able to weather some of the storms, and for the most part within rural Wisconsin, keep the doors open where so many places across the country are experiencing the opposite. So from our perspective, very much challenged, but doing okay in the big picture compared to some of our peers.
So it sounded like there were a few victories that you were describing in that comment. Maybe a little bit more about the victories, or maybe more importantly, challenges that we can foresee here at Tomah Health.
Absolutely. Lift up a couple. On the victory side, I would say rural healthcare within the state of Wisconsin as a whole. I mean, on average, when you look at the rural hospitals, critical access or non, in Wisconsin, we generally fare very well versus the rest of the nation. Quality scores, patient experience scores, outcomes, financial sustainability, we are in the upper echelon as a Wisconsin rural health group in comparison to our peers. So that to me is a major victory. And on the challenge side of the equation, short term, it's what I just talked about, decreasing reimbursement mixed with increasing costs and challenges. Big picture long term, short, mid, and long term, where I am most concerned is something Tim mentioned earlier about declining populations, declining birth rates in rural America, aging population, very real thing. And so for us, that makes us take a look at not just what is going on 2 years from now, but what's going on 20 years from now. And from a recruitment and retention perspective, the pipelines that have traditionally existed are drying up in relation to getting surgeons and physicians and clinicians and caregivers into rural America. We need to reinvest in that state level, national level, as a mechanism to continue to keep great people from staying in local communities or coming to local rural communities to provide care.
So Tim, then you rely on the locals to help out kind of the state view when it comes to rural health. What would you say when you talk a little bit about the importance that the rural health communities have, and because they've really made Wisconsin's kind of stand out in a way?
Well, I think it's a complex series of reactions. I think it's not an accident that Wisconsin, I think, is doing, as Derek said, significantly better than many parts of the country. And I think it's because of a tradition that long precedes any of us, and that's of collaboration. I mean, the cooperative movement is kind of based in Minnesota, Wisconsin. I should have said Wisconsin and Minnesota. And that has made a difference. So competitors And we have competitors within the co-op, but they collaborate with each other. So we have strong community support, and we're working to make and earn that support and make it even stronger. I think it's at the heart of our future. We have, in our country, we have seen a epidemic of maternity services closing, just to give one example. If you look at a map, if you go west and south of here, it's red with closures. We've had some closures in Wisconsin, but very few. And the co-op is at the request of several members. It wasn't my bright idea. It was several members said, we got to address this because sooner or later it's going to start coming here. And so about 18 of our members are working monthly, quarterly to say, okay, what do we have to do differently to make sure that we preserve maternity service? And that ties back to what, Derek, what you said is if you can't have a baby in a community and you're a young couple and you have a couple job choices, which people tend to have, where are you going to go? You're going to go where you can deliver your baby. And that doesn't help the population growth. It tends to take us in the wrong direction. So I think this culture that's the co-op and the hospital association and rural communities across, it would take another hour to describe, I think, all the groups that work statewide for a stronger rural Wisconsin. And that's why I love being here. And that's what it's going to take, because if you don't fight for something, you lose it.
Yeah. You talked a little bit then about, that sounds like a challenge that you've got ongoing, and it's great that the co-op is there looking forward. Any other one or two topics that maybe stand out on things that the co-op is working to address as far as maybe challenge or building on a victory?
Well, we've had a lot of victories, and we will continue to have them. But each of those victories has the reverse side of the coin. So we've done more in rural physician training in the state in creating what's called graduate medical education opportunities than almost anywhere in the country. And the co-op's been a big player in that. On the other hand, I know what the forecast is, and we haven't done enough yet. So we've had success in creating more physicians to work in rural Wisconsin, but we have more that we need to do. And it's, I would say, as true or even more true for nursing. It's kind of hard to run a hospital without nurses. Telemedicine, I think, started to come in to its own during the pandemic, and I think there's fights going on now to make sure we don't fall back to some of the rules and regulations that kept it from being as effective. But I have no doubt we'll win that battle. Partnerships with tertiary quaternary centers are important. It's a place like this does incredible stuff, but you can't do everything. And so part of the maternity issue, actually, I think for everything I can tell from our conversations, is to make sure that our rural hospitals providing maternity services, when they need that extra specialized pair of eyes, that we have the technology to bring them right in for the safety of the mom and the baby. Primary care, I think, is at the heart of an awful lot of rural medicine. And we need to continue to fight to make sure we get the resources to train physicians in primary care. I tend to be an optimist, so I could go on with victories, but I think we've mentioned a number of the important ones.
And some of those victories or challenges that they are working on, Derek, certainly impact what happens here at Tomah Health.
Absolutely, whether it's the co-op, the hospital association, the state, all of those initiatives have the opportunity for direct or indirect trickle down into the work that goes on in this building, in our adjacent buildings and campus or community partners on a day-to-day, week-to-week, month-to-month, year-to-year type basis. So vitally important for us to be involved in those collaborative opportunities, involved in those initiatives to advocate for what we can for rural healthcare.
I know we could keep talking for quite a while about rural health, but I think we gave a nice snapshot to the viewers about kind of what it's about, some of the challenges, victories, and then also really, how a community like Tomah benefits by having a facility like Tomah Health. Final thoughts, Derek?
Yeah, for me, and so much of this we focused on the importance of hospitals and healthcare in local communities, but I would remiss in not saying the flip side, and that's the importance of a good community for what it means to a local hospital. And we can't exist and provide the level of services that we do and reinvest in our buildings and our services and our people if we don't have the support of the community, whether that be as patients, whether that be as positive community members and talking well about the hospital. All of those things have a direct relation to how successful this organization is. So with that, I just want to say thank you to the residents of Tomah, the surrounding area, and the service area that we serve. We couldn't do it without you.
Tim, it's been a real pleasure to talk to you about rural health. We talk via email quite often, or texts or things like that, so to have you in person has been a real treat for me. Final thoughts from your perspective?
Two. One is, I think, to recognize the contribution that Tomah, the community, the hospital, the clinic, makes to other hospitals and other clinics around the state. A big part of our structure at the co-op, we staff host 50 roundtables that meet quarterly, and people get together and they share generously with each other, and Tomah is very active in that role. And anticipating the new year, which is coming quickly, I saw a quote the other day, which I'll share as my last word because I really liked it. It says, "Learn from yesterday, live for today, and hope for tomorrow."
That's great to take to heart, and let's hope for 2025. I want to thank Tim Size and also Derek Daly for being part of HealthCheck 360, and to our viewers and the public, thank you very much for viewing. At Tomah Health, we're inspiring health, wellness, and balance for our community, and you can learn more about Tomah Health and our services online at tomahhealth.org.